Serving all of San Diego, this is your Fox 5 News.
Well, coming up, crazy plastic surgery procedures from adding dimples to changing your eye color. A plastic surgeon will show you what's out there and explain the risks.
In 2008, more than 12 million cosmetic procedures were performed in America, and that number is growing. But the society's obsession with beauty can sometimes be taken a little bit too far. So I have board-certified plastic surgeon Dr. Vincent Marin here to discuss the crazy things that people are doing to change their looks and the risks involved. Thank you for coming in.
My pleasure.
Okay, so let's talk about some of these things. We were just talking about them before we came on, and I'm pretty shocked at some of these. All right, number one, some people are getting iris implants to change the color of their eyes.
Yeah, when I first heard that, I was pretty surprised. It's people are actually putting in implants inside the eye. It sits in front of the iris, that pigmented part of the eye that gives you the color, and it'll sit in there and to change the color of the eye. But it's a dangerous procedure. It's only performed in Central America. It's something that we wouldn't recommend at all. And there's much easier ways to do it, such as colored contacts and things like that.
I was just going to say, is it better?
Safer.
Is that why people are doing it? Wouldn't a color contact do the same thing?
It does the same thing, and it's surprising how dangerous this is for something that's so superficial. I think it's something that I wouldn't recommend to anyone, and I think why it hasn't been approved. There are good applications for it in patients that are born without an iris. They have problems where it has a real functional issue. People have just taken something that really has a good role functionally, but then ends up taking it too far. So that's something I wouldn't recommend, and stay out of Central America.
Away from there.
Yeah, I wouldn't do it.
So here's another one. I guess people, have you ever wished that you had those cute little dimples on your face? I know my fiance has one right here. So some physicians are actually creating these dimples on your face.
Yeah, it's what's called a dimpleplasty, meaning we're just creating a scar from the skin on the cheek down to the deeper tissues to create a dimple. It's not technically that challenging a procedure, but it may look good now, but as your face ages, that's going to be a scar that may be a cute little dimple today, but may end up being a deeper line or wrinkle or something that you have to address later on. So it's not something that we'd really recommend. It can be done. It's not technically that hard, but there are long-term consequences, so you want to really think this out before you go and do it.
I actually have a little scar right here on my face. Do you see it? It looks like a dimple. And I got it from jumping in the bed when I was 2 years old, and I fell and hit my eye, and everyone's like, you have a dimple there. I'm like, no, it's just a scar. So
yeah, it is how it happens, but it's one of those that you really got to want it, I think, before you undergo the knife for that one. So.
Okay, so this new craze is this situation. He's always showing his six-pack, so people are getting abdominal implants now.
Well, what they're doing, it's called etching as you go, and what you do is you take liposuction cannulas that we use, the little tubes that take out the fatty tissue, and you kind of hollow out the area, that line down the middle, and then you can go in those little side spots to try to recreate, even with fatty tissue in place, that abdominal six-pack look. And when that happens, you can kind of create a pseudo six-pack, a six-pack that really wasn't necessarily there. Same type of thing, though, is that what may look good now down the road because you've taken out fat in different areas, if you're to gain or lose weight, it may look different down the road. So, with the situation, he's probably done it with diet and exercise and lost weight uniformly all the way across his abdomen. We're doing it in ways where kind of creating it, and it isn't necessarily the best thing. If you gain weight, you may gain weight in weird ways.
In weird places. You have like one big bulge there and then nothing on the other side.
Exactly. So that's something I don't know that it's, I'd say diet and exercise is still the best way to go with that.
Of course. So. Okay, liposuction for cankles.
Yeah.
What are cankles? Cankles are larger ankles, right?
Cankles are, I think what came out is that when a calf blends right into your ankle, you can't, and obviously an attractive female leg, you want to have a definition between the calf muscle and a thin ankle. It's attractive, and I think that's one that's actually pretty reasonable. Patients that are the right candidate, we can actually do liposuction, sculpt that, and give a much prettier lower leg. And so I think in certain patients, they're just born that way. And if you can make it better with, an hour procedure, that one's worth it. There's issues with every surgery, but that one just takes some time.
And then people are also doing eyelash and eyebrow transplants, but you actually have a much better solution than actually going to that extreme. What is that?
This is Latisse, and Latisse is just a what used to be a product that was used for glaucoma to reduce the pressure in somebody's eye, and they found as a side effect it made the eyelashes grow. So as opposed to going through a surgical issue, you can apply this. wrist just with a little topical brush. You do it once a day.
It's safe.
It's safe. There's a very, very, very small risk that it can change the color of the eye from blue to brown. It's never been seen that they've seen in this application. It's been seen in the use for glaucoma treatment. But from the standpoint of where we are, it's much easier. The alternative is something, it's a great procedure for patients that have been burned. They actually can do eyelash transplants and eyebrow for facial burns. They've lost that hair follicle. So there are uses for that, but in a cosmetic avenue, this one's much easier, just like the contacts, I think.
Well, that's actually something that I've heard a lot about and have always sort of wanted to try, so maybe I'll have to check that out.
Absolutely.
But thank you so much for being here. This is really interesting. And if you want to read an entire article about other procedures, you can go to Dr. Marin, go to his website. You can go to our website and click on the scene.
That's it. It's there too. So,
thank you so much. I'm stumbling over my words.
My pleasure.
Okay,
so,
back to you, Erica.
It's all good, Allie. It's all good.